Hi, my name's Lisa. Welcome to the Naturopathic College of New Zealand DVD. This physical examination DVD has been made to complement your physical examination student guide and your compulsory textbook. All aspects of this DVD will again be demonstrated by a tutor at a workshop, and you yourself will demonstrate these physical examinations. You may ask yourself, why learn physical examinations? Physical examination skills are valuable tools as the information gathered by using the physical examinations will help you to establish a more founded working diagnosis, and also to identify when a client's ailment is out of your scope of practice. Physical examination techniques. There are 4 basic physical examination techniques. The first is observation. You will be using your eyes and your ears in observation, and it begins as soon as the client walks into the clinic. Note any abnormality that you can detect and document this on the client case. Palpation is the second technique. This involves feeling the client's tissues with your fingers and hands. You use your sense of touch to assess the temperature, the presence of tissue growths, and to check for the presence of tenderness. The third technique is percussion. This involves tapping or striking over the client's tissue. You'll be using your hands and listening to the sounds that are being produced. The fourth technique is auscultation. You will be using a stethoscope to listen to the sounds that are occurring within the body. I'm going to start the physical examination by taking the vital signs. We're going to take this client's temperature. I'm going to use a Braun thermometer. This is a tympanic membrane thermometer. The speculum has a cover. This cover is used for hygienic purposes. Place the cover over the speculum. Place the speculum into the client's ear and push the button for a reading. Place the speculum in the ear. You'll be waiting for a beep. This means it has taken a reading. Look at the reading. This reading is 37 degrees Celsius, which is a normal temperature reading for an adult. We're now going to take the client's pulse rate. We're going to use the pads of your fingers and place them over the radial pulse. Count the beats for 30 seconds and then times this by 2. This will give you a pulse rate per minute. Between 50 and 100 is the normal pulse rate for an adult. What you can do is continue to leave your fingers on the pulse once you've counted for 30 seconds. Then look at the chest and notice how it rises and falls. Count it for 30 seconds and then times it by 2, and this will give you the respiratory rate. The normal range for an adult is between 12 and 20 respirations per minute. We're now going to take the client's blood pressure. Place the arm cuff of the sphygmomanometer onto the upper arm. Note that the arrow on the arm cuff is at the level of the brachial artery, which is medial to the biceps tendon. Make sure it's firmly on the arm. Place the dial onto the arm cuff. There's a clip at the back. Make sure that the valve is closed. The first thing for you to do as a practitioner is to estimate the systolic blood pressure. To do that, place the pads of your fingers onto the radial pulse. Inflate the arm cuff quite quickly up till 90 and then a little more slowly, concentrating on when the pulse cuts out under your hand. In this case, it cut out approximately at 110 millimetres of mercury. Once you've estimated that, you quickly deflate the arm cuff. Place the stethoscope into your ears. Tap the diaphragm to make sure you can hear the sound. Place the diaphragm over the brachial artery. Make sure your valve is closed. Before we estimated the systolic blood pressure at 110, we're now going to pump it up 30 millimetres of mercury more to 140, then slowly release the valve. Release the valve slowly. Listen for when the first heart sound comes in. This is your systolic blood pressure. Continue to listen until it is silent. This is your diastolic blood pressure. Then listen for an extra 10 to 20 millimeters of mercury to make sure there's no extra sounds. Once you've established that, release the valve completely to deflate the arm cuff and take it off the client's arm. The first sound that I heard was at 120 and it was silent at 80. So the blood pressure would be 120 over 80 millimeters of mercury. This is the average reading for an adult. We're now going to palpate the regional lymphatic nodes of the head, face and neck. I'm going to start with the submental lymph nodes. Palpate with your finger pads with slow circular motions. You're going to be feeling the nodes for the shape, size and consistency. Next one's submandibular, which is under the jawline. If you do feel a node, check with the client if there's any tenderness. There's the parotid, the tonsillar. Preauricular nodes, which are in front of the ear. Behind the ear, which is postauricular. Occipital, at the base of the occiput. The cervical, which is in front and just around where the sternocleidomastoid muscle is. Palpate bilaterally, both sides. And above the clavicle, which is called supraclavicular. Now we're going to examine the nose, mouth and throat of the client. We're going to start with the nose to check for patency of each nostril. Could you please occlude one nostril and sniff in with the other, and then do the opposite side, please. Thank you. In this case, the client can sniff with each nostril. If this is absent, it could be a sign of something such as nasal polyps or rhinitis. We're now going to inspect the mouth and throat. Due to the presence of body fluids, I have a glove on my hand for hygienic reasons. So first, take a look at the lips. Check the lips for the colour, the moisture, check if there's any cracking or any lesions on the outside of the mouth. Could you please open your mouth? The next thing we're going to look at is the gums. You're going to check the gums to see if there's any bleeding, just a bit wider for me. Check if there's any bleeding, swelling, retraction. Then focus your vision onto the tongue. Check the tongue. The normal tongue is an even pink colour. It may have a thin white coating. Inspect for any discolorations, an enlarged tongue, any thick coatings, any lesions on the tongue. Check if there's, can you just poke your tongue out a bit? Check if there's any indentations or teeth indentations on the outside of the tongue. Also if there's any excessive saliva. Once you've had a look at the tongue, also inspect the inside of the cheek. Just pop your tongue back in and keep your mouth open. You can use your otoscope and use the light to illuminate the inside of the cheek. You're going to have a look for discolorations to see if there's any lesions. Then poke the tongue out again. You can use a tongue depressor, pressing on the tongue so that you can see the soft palate and the hard palate and tonsils area. Push on the tongue, be careful not to trigger the gag reflex. And you're going to look in the back of the throat for any discolorations. Have a look at the tonsils, what shape they are. The tonsils are normally the same colour as the general oral mucosa. Their surface has indentations called crypts. Tonsils are graded in size. 1 is visible, 2 would be halfway between the tonsillar pillars and the uvula, 3 would be touching the uvula, and 4 if the tonsils are touching each other. While you're checking in the mouth, also notice any breath odour. Check if there's halitosis, which is a bad odour, or maybe a sweet, fruity smell such as in diabetes. We're now going to demonstrate an inspection, palpation and internal inspection of the tympanic membrane of Mark's ear. In a normal clinical situation, you'd check with the client which ear was giving the person irritation, and you would always check the non-affected ear first so that you wouldn't transfer the infection into a good ear. For this demonstration, I'm only going to inspect one of the ears. So you're going to start by looking at the ear. Inspect the auricle and the surrounding tissue for any difference in colour, if there's any lesions. Have a look if there's any serum coming out of the ear, if there's any swelling at all. Also have a look if there's any narrowing of the ear canal. Also check if there's any foreign bodies. A child may have put a small piece of Lego or something in their ear, so you got to make sure that's not there. Then you can start palpating the auricle. You're going to palpate to check for tenderness, to check if there's any nodules. Gently pull on the lobule and also push on the tragus. Also push on the mastoid process. If it's sore when you move the outer ear, it could be otitis externa. But if it's sore and there's pain pushing on the mastoid process, it may indicate otitis media, mastoiditis, or an enlargement of the postauricular lymph node. Now we're going to do an internal examination. Get your otoscope and turn the light on. Hold it like a pencil and rest your hand on the client's cheek. If you're going to check into a child's ear, you're going to pull the ear downwards and backwards, but for an adult, we pull it upwards and backwards. We place the hand on the cheek for safety reasons and for stability, so that if Mark would move his head, my hand would move with it and I wouldn't hit the tympanic membrane with the speculum. So rest your hand on the cheek and going slowly into the ear, continually looking through the otoscope, looking at the condition of the ear canal and at the tympanic membrane. The tympanic membrane should be translucent, pearly grey and shiny. You're looking if there's any discolorations, swelling, perforations, excessive serum, which is earwax, and also if there's any exudate. Thank you, Mark. We're now going to demonstrate the thyroid examination. We're going to use both inspection and palpation. The thyroid gland consists of two lobes which are joined by an isthmus. It lies in front of the larynx and trachea at the lower half of the neck. The normal thyroid is neither visible or tender and is not normally palpable either. If it is enlarged, it is called a goiter. We're going to start with inspection. Stand in front of the client and look at the lower half of the neck. You're going to be looking to see if there's any enlargements or nodules. Also, if it was symmetrical, bilateral, or if the nodules are just on one side, left or right. It can present enlarged all over the thyroid or just one side of the lobe. Ask the client to have a sip of water. When they're taking the sip of water and swallow, the thyroid gland actually moves a little bit superiorly. Can you please take a sip, Mark? Thank you, Mark. We're now going to do palpation of the thyroid. So move behind the client. Ask the client to tilt their head downwards and slightly to the left. I'm going to palpate the left-hand side. Place the hand in between the sternocleidomastoid and on the trachea itself. Pushing on the trachea will displace it so that you can palpate the thyroid as it moves to the left side. You're going to palpate for enlargement, the consistency